So fat transfer has become an immensely popular procedure in the last several years, probably most notably because of sites like Real Self, Instagram, and whatnot. We've seen approximately a 400% increase in the number of fat transfers to the buttock in particular. I think that's what's been really popularizing fat transfer in plastic surgery. And in our practice, we do that, the BBL, which is the Brazilian butt lift. We do fat transfer to the breast quite commonly for those patients that are just looking for a little improvement in shape, upper pole fullness, and improvement in cleavage. In my practice, the running joke is we can put fat just about anywhere. In my practice, I have placed fat into the deltoid muscles. I have placed fat into the biceps, the triceps. We have placed fat into the oblique muscles. We have actually placed fat into the pec muscles to enhance male pec augmentation. And so we pioneered techniques, in fact, in this practice to be able to do that under ultrasound guidance. A technique that I pioneered called ultrasound guided fat augmentation technique, which I call UGFAT, is a technique by which we can actually visualize the way we put fat in. In our practice, we have the state-of-the-art technologies to both harvest the fat and to place it back in. For harvesting, we actually have a device called the Wells-Johnson High Volume Precision Autologous Fat Transfer technology, which is the best technology in the market today to both harvest and then re-inject the fat. We also use the Vaser. With the Vaser fat, interestingly enough, compared to traditional liposuction fat, is better suited for fat transfer. It has at least as much, if not better, take over time than traditional liposuction technique, in my opinion. And that's because the fat that we are actually injecting is of a millimeter in size versus traditional 4 millimeter size in traditional liposuction aspiration. So the Vaser is helpful in that. And then with regard to the technologies, again, for re-injection, we use in the buttock and the breast areas what's called basket pre-expansion, which allows us to get 50% more fat into subcutaneous tissues than we would with traditional old-fashioned techniques. And then the ultrasound guided fat augmentation technique that I pioneered actually is helpful for precision placement of the fat in many of these areas, as well as into the smaller and more delicate areas such as the biceps, triceps, obliques, deltoid, pectoralis.